to our career goal setting workshop. I'm Carly. I'm the founder and president of the Canadian Public Health Hub. And we were wanting to do this earlier in the year, but I actually haven't even sat down and done any goal setting for myself, for my career this year. I keep saying like, oh, in a few months, in a few weeks time, like when I have, some downtime, I'll sit down and finally do it. And now it's May. So I think, I appreciate anybody kind of jumping into this at any point. Let me get my slides going here. I think it's, I had a few people reach out and they're like, does goal setting really work for me if I'm a student or I don't know where I'm going yet? And the answer is like, this is especially handy, I think. I still feel like I don't know where I'm going with my career. And so I think there's ways to start to get excited of like the things that you get to do as part of your career, even if it's not a clearly charted path of just, what are the things that set your soul on fire a little bit? Where are those passions and how can you take more steps to be, engaging in those different aspects? And so if you feel lost, that's totally okay, especially because this is a really hard field. And I hope just by like, going through some activities, this is just going to be like a lot of self-reflection, but with some prompts that you might start to get a little bit more excited. And this is something I've done, especially when I'm facing those periods of uncertainty and uncertain what to do next. I just want to do a little housekeeping. If there's anyone that's interested in having either a mentor or mentee feature on our social media, we've been sending out emails. You can fill that Google form out at any time. There's not like a set, deadline or anything. Just fill that out and we'll post it. We'd love to showcase. Also, if you're having any issues with your triads, or you're not hearing back from people, if you're not having regular meetings, please let us know. And our team would be very happy to like rearrange or try to provide extra support to either mentees or mentors in any way that we can. We also put a call out for speakers. So if you are thinking about, maybe it's one of your goals is you want to host your own workshop, reach out to our team, reach out to myself. And we're also looking to build out our social media a little bit more. So we're looking for a director of communications to join the team. We've filled out the team with 3 other directors, but that's kind of the missing link. And so if anyone's got really good Canvas skills or you I don't have them and I've been trying to run it all myself. So if, want to practice that skill, would love to have folks, reach out and get involved. So this is just a space. You can just jot it on sticky notes, on a blank piece of paper, in your journal, whatever you have. It's however you're showing up is perfect. But this is just a space to brainstorm because you probably haven't, I haven't had time to just sit down and start to think of these things of, what are your current aspirations, your future aspirations, just so that you can kind of like keep moving along in your public health career journey. We're not going to ask anybody to share things. I absolutely hate when I'm put on the spot and like asked to talk about my deepest, darkest, goals and things like that. So we're not putting anyone on the spot. So feel free to just, between you and your journal, if you want to share it, you totally can. It does help, science shows that it can help you be more successful, but I'm not going to put anybody on the spot. And, just trying to break things down, goals into some really clear steps so that you can reach the outcomes you desire from your career. And I really like the goal or the quote, a goal without a plan is just a wish. Because I notice when I'm not setting aside time to think of steps and I'm just thinking of this like far off outcome, that it's really hard to try to achieve that. And so breaking it down into that plan makes it a lot more achievable. So this is just a little breakdown. We're going to go through some primers, some different kind of goal setting tips. I find it really handy to basically ask ChatGPT to do a lot of the work for me. So I asked ChatGPT a ton of questions of public health goals that I could potentially use or all of you could use. So we're just going to kind of go through some. And if there's anything that you like, jot it down. And then when we do the large scale facilitated reflection, that will be really handy. And so that way we'll also in the last few minutes just try to, we're 4 months through the year already. We have another 8, ahead of us. So if you want to break your year down into quarters and think about it that way, that could be super helpful. So starting with the primers, as I shared, goal setting in public health is really hard because there are so many diverse career paths. And I think many of us don't, doing our undergraduate degree, doing our master's of public health, we don't necessarily know where we're going. And there's just so much variety even between roles. Like if you're working as an epidemiologist, that's a lot of data versus a health policy analyst is very upstream writing versus community health workers, boots on the ground. And a public health nurse is even different, than all of those and needs a very distinct education. And so because of that, there's also different sectors that you can work in. There's academia, government, nonprofits, consulting, private. So I actually found some statistics of what most people end up going into public health, which I found very eye-opening because I, thought it was very much nonprofit sector when I started. And so seeing the fact that like about 40% of people go into government, very eye-opening to me. And I think too, if you're not sure which even career sector you're going to land in, what role you're going to land in, you can also just think of the skills that you have, the skills that you want, and kind of move from there because there is a lot of transferability between them. So data analysis, communication, program evaluation, those are the kinds of things that maybe if you're not sure where you want to go, those are the things that you could focus on for goal setting. And so just in terms of why it's so important to think about these things as a public health student or professional, the field of public health is constantly changing. And so our workforce and the skills that we need will be changing, of course, too. I started working during the pandemic. And so I worked leading the COVID response. And then that shifted to broader health emergency management. So for the region that I live in, we have a lot of wildfires and floods. So I was responding to that. And then I shifted into policy work. And so now I'm working with policy windows. So sometimes it's gender-based analysis plus, GBA plus. Other times, the government says something about funding with DRIPA and, the United Nations Declaration of the Rights of Indigenous Peoples. And that's something that we lean into. So even just what's popping up in the news, what political, key players are saying will affect job openings and the work that we need to do. And of course, if you have clear goals, you can be a little bit more adaptable to that changing landscape and find a niche or a window as jobs kind of pop up. So, of course, there's so many different ways to set goals. I wasn't going to necessarily have any recommendations because our brains all work very differently. I think most people have heard of the SMART framework. So you've got your, specific, measurable, achievable, relevant, time-bound. And then that way you just have like a very clear, for example, in 6 months' time, I'm going to publish an article in a public health journal. So you have very clear steps of, it's not just, I'm going to reach out and hopefully you want it to be published. You've given yourself a time frame. It's in a public health journal. It's, not on, just a website or a blog. You have a very clear breakdown of the steps that you want to take to reach those goals. Another thing you can do, you could think short-term, long-term, you can kind of map out your career. So this is something, if anyone's part of the public health, the PH spot, they did a really neat workshop. So you can always kind of go back if you are a member of that kind of space. I loved it and was going through it a couple times of just thinking, when I'm retired, this is what I want to have achieved. And then kind of working your way backwards across your career of like, okay, these are the milestones I would have to take to get there. You can also think of, buckets or categories, like maybe you want to think of what your health looks like as part of your career. What are the networks or relationships that you have? Financially, what does that look like for you? What's the impact that you have? So again, I'm not going to I would just say start jotting things down however it fits your brain, start organizing it, and then kind of as the final steps, we'll figure out the best kind of timeline and course of action that works for the map or the brainstorm that you've created for yourself. And so I find this really fun because sometimes it's hard to even get started. But this is a bit of an idea of just primers that ChatGPT has come up with for potential goals. And so I would just say jot anything down if you're like, yes, at some point, before my retirement, that sounds super cool. Or like in the next year, even that sounds fabulous. That's something that, feels inspiring. Even if it's like very intimidating, I would say just quickly jot it down for yourself. So here's a few examples, maybe when you're thinking about your professional development, there's so many certificates and conferences out there. So maybe you want to get a certification from a certain organization and you're going to set aside time for that. Maybe you want to go to a certain amount of conferences. Maybe it's just attending. Maybe you want to present. Maybe you just want to read a book or an article. And what does that look like? Is it every month? Are you sitting down? And it's going to be 6 books across the next 6 months. Are you starting a book club? Those kinds of things. Maybe it's skills based and you want to learn, some sort of programming that will really help, or like tools that'll help with, potential future careers, or maybe your current job. It would be really nice. Other people in the, portfolio or in the team are using these, and this is something you haven't picked up yet. So something like that. Maybe you want to improve your public speaking and want to do a certain amount of presentations at a conference. And then, maybe you want to think about your network. So if you're feeling really lost, you don't even know where to go, a good starting point can be just sitting down with people and doing informational interviews. Maybe it's even 20-minute chat with someone you met on LinkedIn, if that's really outside of your comfort zone. You could expand your LinkedIn network by 50 new people that you find are super cool. Maybe they're Canada-based, in your province. Maybe it's just worldwide and you want to kind of look what's out there, find people that you find inspiring. Maybe you want to join a professional organization like the Canadian Public Health Association and attend any meetings that they have over the course of the year. If you're thinking of research and writing, you can submit an article to a journal. You could, this is starting to get a little repetitive, as AI can be, but maybe you want to do a blog post. And there's different platforms out there and you can look it up. You can even send it to news agencies. Maybe you want to start your own blog. Maybe you want to try out briefing notes and look for a course for that. And that's something that we're working on as a team, because that was a big ask of a lot of folks when they joined the Public Health Hub. And then maybe you're thinking like, I'm ahead of all of these other ones. I'm feeling very confident in my networks and in my, my skills, but I want to advance my career. So maybe you're going to apply for new jobs. You're going to take it to the next level. You want to be a manager. You want to be a director. Maybe you want to switch and do policy analysis and you start working in the government and make that leap. Maybe you want to start a new project even on your team and do that until, the end of the year. Maybe you're looking for work-life balance. And so just integrating a little bit more physical activity at the end of a workday because you otherwise feel absolutely exhausted. Maybe you're going to try to set personal boundaries and you're not touching your work laptop after 7 p.m. Maybe like a little getaway, because that's something, you're just so focused at work, so focused on school, and you haven't had time for vacation and just de-stressing your brain a little bit. Even if it's like negotiation and leadership, maybe you want to ask for a pay increase. You want to attend a really cool professional development workshop. That's a skill set that's totally outside of your comfort zone. Maybe you want to, project management is huge in the field of public health. So maybe you want to look at doing your project management professional certification, the PMP. Maybe you want to start, a new report at work, or you want to try a new tool. Advocate that like Trello or Asana is something that your workplace tries out, or maybe you're just going to try, a free subscription to one of these platforms yourself. similar, just getting into like relationships that already potentially exist. Maybe you want to have a better connection with your manager and you're just finding you don't have a touch point. So you're gonna create a really good kind of one pager, and ask your manager to meet and go over the things that you're working on and ask for some feedback to really try to grow. Maybe, you want a bit better feedback at work of like what's working well, what isn't, and you're going to create a bit of a tracker for yourself, or even like a career compliment tracker, which is something I've started this year. Of anytime I get positive feedback or praise, boom, it's there, and I can remind myself on bad days, this is the positive things that I hear. Or if you're looking for, a pay increase, you can turn and be like, hey boss, remember that time you said all these amazing things about me? I've got the dates, I got the receipts. Maybe you want to, use the Pomodoro technique and try to focus more in studying, or even find more balance so you're taking breaks. Find a better study schedule for yourself, those kinds of things. So that's just a little primer just to give you some ideas. If there's anything that resonated with you, hopefully you kind of jotted it down, but just gets the juices flowing. Because I know sometimes when I try to think of my career, like what's the next step, even just breaking it down into, okay, you know what, I don't know where I'm, like what my skills need to be or what role I'm going to have, but I'm going to build my network right now. Like just, picking up on something should make it a little bit more manageable. And then again, as I said, when you're trying to start doing some of these reflections, there's no one size fits all, approach with any of this. You know yourself best. So just, this is some time, do your own brainstorming, and, potentially feel inspired by some of the ChatGPT prompts, or, just some of the dialogue today. And then any system that works best is totally valid and totally appropriate. So lean into that. Don't start overthinking it of like, I need to be more organized in my goal setting. Because I know sometimes I do that as like a procrastination technique. Maybe, you just feel really stuck today thinking about this. That's okay. Maybe this is homework. So it may not just all kind of come to you and click in this hour, but it gets the ball rolling when you sit down tomorrow or a week from now. And so we're going to think, sometimes it's really handy just to understand where you are and where you've been, to appreciate everything you've done so far and then help you with the trajectory of where you're going. So we're going to take 2 minutes. I'm going to do this in real time with you as well, of just what got you here. What drew you to public health? Why are you continuing? Why are you doing this education? Why are you studying long hours, doing the long work hours? What's that why for you? And then that might help you, figure out those passions more clearly to keep moving forward. Also, what are the kind of challenges or barriers you're facing? Is there a reason? Are you wanting to pivot? Is there a reason for that? What's the biggest challenge? And what are the skills, knowledge, or experiences that you are missing? So we'll take 2 minutes. I'll stop talking and we'll start thinking about this. Okay, I feel like that was 2 minutes, so we'll kind of start moving forward. Um, it's a little hard to like. I'm solid with my why, and I always, I am a bit of an overshare. I like being vulnerable, so I'll share just that I'm confident in my why. I know I was very naive when I started my Master's of Public Health that I thought I would change the healthcare system and really like start tackling those inequities. Um, and like that's hard to do, especially when you're starting at, at the base kind of level, the lowest level in a corporate setting. And now for me, it's really shifted to just health and wellness more generally. I work in First Nations health governance, but I think those are very transferable skills to, populations that are often left behind, who are historically under-resourced. So very much health equity and wanting to shift the system little by little. And so I think, those can be the underlying, part of anything that aligns with goals for that, I think is really good. For me personally, the biggest challenges I faced is trying to figure, I know I want to continue my education, trying to figure out, admissions in different programs are really competitive. And so even just taking the leap of, is it a PhD? Is it a doctor of public health? Which of those is a better fit? Like, I don't even still fully understand either of them. And so going through the admissions processes feels really daunting to even start towards one because my job is comfy, right? But I currently I love my job, but it's very upstream and I miss working with people. And so I don't know if continuing my education would get me that like boots on the ground connection that I'm lacking. Um, and then honestly, in terms of skills, knowledge, and experience I'm missing from my toolbox, like that's something I'm gonna have to keep thinking about. Because I feel like probably just the information of like what next step to take with those challenges. I think I need a bit more information of, what's out there, what's going to be the best fit for me. But yeah, hopefully that was, a helpful exercise to think about of just, okay, I have my why in mind. Now let's move towards future goal setting with that like, circled, highlighted for yourself. And so we are just going to take a little bit of time, 5 minutes or so, just to identify some future goals. And, if you want to think about your values, your aspirations, your priorities right now, just start jotting those down. Just do a bit of a brain dump right now. And just any kind of reflection, again, that helps you find that why and make sure that you're aligned with that future career vision. Oh, we got someone in the wait room. Oh, there we go. Hello. And so for this, next 5 minutes. Hi there.
Yeah, sorry.
No worries. No, not at all. Yeah, so we'll just keep moving forward. 5 minutes to just again, it's like thoughts to keep you in line with that why, because I know sometimes it's really hard to think of it. So what's the kind of impact you want to make in public health? Right? For me, it was all about inequities, but I don't love being so upstream. And so, are there specific roles, projects, organizations you aspire to work with? My dream was, finishing my MPH. I was like 40 when I'm 40. I want to be working at the First Nations Health Authority as a senior policy analyst. And I couldn't hear back. I wasn't hearing back from anybody. And I started to apply to those kinds of jobs earlier. And 2 years out of my program landed that dream job of mine. And so, even having that, like, oh my gosh, there was someone in my cohort that was talking about this thing and it sounded really cool, jot that down. Can you also articulate in one sentence, like, what's your dream role? What's that ideal impact? Where do you see yourself in 5 years, 10 years at the end of your career? So this is just a bit of a start to think of those kinds of things. So I'll stop talking again and I'll jot this down in real time as well.
Okay.
I did not have a timer on of any sort, so I don't know if that was 5 minutes, but I feel like I finished my reflections, and it's all good if you like need to take this away as homework, or we'll keep thinking of this in other spots in this workshop. But yeah, I think it's, it's always hard to hone in on that why. I was starting to even, I know the reason I got into public health was because of my passion for women's health, family, early childhood health. And I haven't touched that since graduating. I did briefly for my practicum, but it's been 4 years and I haven't been involved in that space at all. And it doesn't have to be a career or like a job role necessarily. And I started to brainstorm like, be really cool to have touch points with different organizations that were a little bit more like service delivery, boots on the ground. Maybe that looks like volunteer work. Maybe if I do decide to continue my education, trying to integrate that population in mind for me. And so, yeah, even just thinking like 5-10 years, what might that look like? How might I integrate that into my career was just a really handy kind of reminder of like, okay, maybe I got off the path a little bit, and there's like, it doesn't have to be a total career shift, but ways that I could start to integrate that. So I hope that was kind of a handy just process to go through. And I liked this idea of, I've seen this in other kind of goal setting workshops of just thinking about like more broader of what the needs are, or, what do you excel in? What are the skills that you want to develop? But also what's needed. So, there's lots of public health issues out there. There's so many facets. You don't have to spend a whole career to one. And so, if you're thinking of the like broader social determinants of health, what are things that you're super passionate about? Or, the different even functions of public health. You have health promotion, you have health surveillance and data, health protection, changing those policies, population health, disease and injury prevention, emergency preparedness and response. So even just starting to, you've got your why in mind. This is just a moment to like a little aside, but what are those things that you, when you were studying, are like, yes, this is, I get to do a forum post about this, or this is an essay I get to write. So we'll just take 3 minutes to start thinking about that. Okay, again, I'm not timing this by any means, but yeah, I just started to jot some things down for myself. Again, having wanted to work more with, early maternal childhood, um, health sectors, just started to jot some like social determinants of health, but also the linkages. Maybe if I'm working on like a school health team, that could be something that links in, right? There's so many facets and so many ways to contribute, even if you have like a broad goal in mind. I used to do a lot of injury prevention, especially like kids are the ones that often injure themselves because they're exploring the world, right? And so that might be a really good facet for me. I used to be a researcher for injury prevention and trying to think of ways to get engaged with that space again. So we'll keep moving along. This is something, I don't know, I think of it often of like, okay, I know sometimes I get myself worked up. I'm 27, I don't really plan on like retiring early. I love public health. I love work. So let's say if I retire at 65, I still have 38 years ahead of me. And so, of course, I'm not going to have the answers. I'm not going to have the path, clearly defined. And so, even just thinking, here's me on my porch swing. Apparently, I have a cat. But just thinking of like, okay, I've retired. What did you do? What was the impact? Like, sometimes I go to really cool Public Health Agency of BC conferences where they're giving away awards to these people that are retiring, and they've done such cool things. Like, there was this guy who was a physician, and he saw a lot of his pediatric patients coming in with burns, on they were in their pajamas, and like the material for their pajamas would light on fire really easily. And so he like would go down and talk to the government and had them change the material that children's pajamas were made out of. And so like it's the little things that like that's still public health. Just what's a curiosity you have if people at a public health conference were celebrating you when you're 65? What did you do? What are you known for in the field? But also, how did you like, you also spend time on the porch swing, right? You find that balance in your life. So we'll just take a few minutes of thinking of like, okay, I retired. What did I do? What are people celebrating? It doesn't have to be that like you were the best field epidemiologist of all time. Like maybe it was you noticed a trend for 30 years and you spoke up about it and you wrote a briefing note to the federal government and lobbied and had things change. Or like maybe you started to run in government because it was such a thing you were passionate about. So again, I'm gonna stop talking. But this is, something that gets me very excited is just thinking of how did you find balance? What were you celebrated for? Okay. I've stopped thinking of ideas, so I think we'll keep plugging along. I hope I'm not rushing you. But yeah, this is a tricky one. I could not think of what I would be known for. But I could think of what I did, which interesting, like I would have thought there's similar questions. At first when I was like, oh, dang it, I duplicated, but I don't think I did. I was thinking of like I would love to help a lot of people like patience, boots on the ground, and like, try to destigmatize things in the health sector, which is really hard to do as a policy analyst. So maybe I do need to move more boots on the ground at some point. Also like I'd love to help people advance their career through mentorship, through the mentorship program, through, the spaces I created. Even just thinking of balance, like I would love to see the ability to travel a bit more for work and like vacation is part of it. So just little things that kind of got like a new new line of thinking for me of like I hadn't really thought about this for my career, and it's a little different, but hopefully helpful. And if this is like if there's any little exercises that are so not working, don't worry. This is like they're just supposed to be fun, a little bit tangential just to get the ball rolling. Now is like the nitty-gritty. Let's set some goals. Some potential categories to think of, but you are free to go however works for your brain. But maybe you want to categorize it for yourself. I'm very much like these are my buckets in my life. Of like here's my education. I want to, continue and do a doctor of public health, PhD, MD, whatever. Here's some professional development I want to do. So, certifications you want, soft skills. Like maybe you're like, I want to be a good negotiator because I keep lowballing myself in these job interviews and taking the lowest pay, like something like that. Job advancement. Maybe you want to get a promotion. You want to move up the ranks, even in the next 20 years. Like maybe you're thinking, I want to become a manager, and then I want to be director, and then I want to be the executive director, and then I want to be the vice president. Maybe you want to increase your network, really get that LinkedIn going. Think of opportunities. Like you want to be on a board. You want to be the keynote speaker at a conference. Maybe you want to start your own initiative. Maybe that's like you write a children's book. You start a nonprofit. You start your own podcast or Instagram like health promotion page. Also, like how did you find work? How do you increase your work-life balance? Because I know that's something everybody can work on to some level. You do not need to start doing any timeline or steps. You could just do big picture. We're just going to do a big brain dump of like, okay, for education, or, I got another 40 years ahead of me. Boom, on the page, all the things you want to accomplish. And I just put some random thoughts there at the bottom. These are things, I've jotted down because I've heard other people say them. And I just thought they were really cool and, really badass for people to get involved with in the field of public health and things I didn't know you could do. So we'll take a bit of time here to just start brainstorming. I'm going to do the same. So maybe thinking about at least 5 minutes, but I want to make sure we have enough time at the end too. So we'll get started with that. Okay. I think we'll keep plugging along because I realized I have another 9 slides. And I thought would be further along than this. So I think I'm just speaking a little slow. If what you have right now is just a little brain dump, that is a-okay. That's what mine looks like. It's nice to just get the juices flowing, get some ideas going. You can always look back at kind of those primers that ChatGPT came up with, or even work on your own ChatGPT prompt. You can start, even have it ask you questions and start just kind of regurgitating some things that it thinks would be really useful for you, using your skills, using the things that you find really interesting and that you're passionate about. And so just as the last activity, we're going to start to create a bit of a timeline for ourselves, because I wanted to do this like early April. That was the second quarter of the year. I'm really into kind of breaking my year into different quarters. And so we're going to go over some concepts for this. If this isn't going to be super helpful because you haven't finished your goal setting yet, no worries. This is just something I wanted to share a little bit about. So I read this book. I have it over. I was going to show it, but I feel like I'd have to scooch across the room and that's awkward. There's this business book called The 12-Week Year. I had heard a lot about it. I did not realize it's a business book and it's for corporations to make them more efficient. So you really don't need to read it and spend your money on it, in my opinion. There's some really good YouTubers. Ali Abdul has a really good video on it of just how to break your goals, however they look, into little 12-week segments. And then they say by doing that, you have this sprint of, I'm going to change focus every 4 months. And then that way it's basically a mini year. Because you get 1 week for each, or you get 1 week out of 12, so that's like a mini year. And then that way you really can change focuses. And it's really like, it's about execution, not perfection. It doesn't allow you to procrastinate. And then you can kind of like move around, give something your all. So maybe it's like physical for one, and then the next one's mental, and you can give yourself a bit of a break between. So it's not trying to balance it all. It's being very strategic. And then another thing is just, creating a bit of a timeline of organization of, hopefully like the next 1 to 2 years, that's what we'll focus on. But maybe some things you jotted down is more like 2 to 5 years, 5 to 10 years, 10 to 15 years. So, just kind of like take what you have so far in your brain dump and just map out, like, is there a timeline for this? So we'll spend a minute or two just putting big circles around of like, hey, this isn't achievable right now. I need more skills. I need to go back to school. I need to talk to professors, whatever. But even just starting to put a timeline of like, hey, what might that look like? What do I want to potentially be this quarter, the last quarter of the year, the third quarter of the year? So just a couple minutes to quickly organize it like that. Okay, hopefully that was helpful. Just like quickly jotting down, this is the 1 to 2 years, this is this quarter, etc. And then I realized my slides got a little mixed up, but thinking of your 12, for the items that were in the 1 to 2 year, maybe you want to try to do a little sprint of it in one of the quarters this upcoming, within this year, one of the upcoming quarters. So, we had January, February, March as one quarter, April, May. So we're in the second quarter. So maybe between now and June, that's your second quarter. There's something you want to achieve. July, August, September would be your third quarter, and October, November, December would be your fourth quarter. So if you did like thinking of your top 3 goals for this year, getting your education done, talking to some professors, starting to apply to jobs, really improving that resume, whatever it looks like. Dump that down, put those down, and then think of which are urgent and which are long-term. I'm really bad about creating these rush timelines for no reason and not being strategic. So really think, what's going to make the most sense? Are there any that I can combine because they actually, serve a dual purpose? Like if I wanted to get a better reference letter, I would probably do that at the time I'm applying to different like Doctor of Public Health programs. So those go hand in hand. And then if you wanted to write like for Q2, April, May, June, so the one that we're in, you could think of what's the main goal? And is there a key action or milestone or even a few that you'll complete over the next 12 weeks? So maybe it's repetition and habits, habit formation that'll make it stick. Maybe it's a bunch of steps and you just want to break it down. So maybe it's like, I'm going to jot down 30 minutes in my calendar every Friday to check in on this. Or maybe I'm going to spend 30 minutes, once a week to just message people on LinkedIn and try to get an informational interview or, something like that. And then you can also, if you want an accountability buddy, you could use your mentor triads. But we'll give, a minute or two, because I know we're getting short on time here, just to quickly think of what you want the quarter to look like. Okay. That's probably not as much time as you needed, but I've already done this. This is like, I'm very into the 12-week year. Do not recommend buying the book though. And so for myself, I want to develop some templates for the Canadian Public Health Hub. So that's the sprint I'm in. Started April 1st. So I've been working on it for a month already. For my third quarter, I'm planning to do a homelessness gaps analysis in my hometown because this nonprofit that I volunteered with for 5 years shut down, and they served the majority of the folks experiencing homelessness in my as a population in my hometown, and they're very underserved now. And I want to get involved in that space, so I'm gonna do a gap, like very public healthy, do a gaps analysis that quarter and start talking to people and think about what the biggest gap is and where I might be able to get involved. And then for my fourth quarter, I want to finish writing a second children's public health book. So those are things that, they're very different. There's no urgency necessarily for any of them. I really wanted to get this template done for this cohort. So, that's why it's this quarter. But, that's just an idea of the kind of thing that I've broken my year into. Another quick example, like maybe you've decided you want to do a health education Instagram series. And so between April to June, or, maybe you want to shift it May to July for yourself, because you can start the 12. That's the nice thing too, is like the 12-week year is supposed to be started anytime. Doesn't have to be the first of the month, even though that's what it is today. Maybe that looks like, in that quarter, you're going to research 5 health topics for content. You're going to draft a 3-month content calendar. You're going to design 6 graphics in Canva, and you're going to launch, the first post, you're going to have them lined up by June 1st. Maybe it's going to be like every month you're going to have a new post, or maybe every week. This is something that's really fun to just, mess around with ChatGPT too, to give it some goals, have it do the 12-week year. Fun stuff if that's, what you're into. And then, another potential thing, just if you're feeling really inspired, you've got a plan, sometimes it's handy to just jot down for yourself, like, what are the potential obstacles that might prevent you from achieving those goals? What strategies might you be able to implement? How can you keep yourself accountable? So I have a little check-in. I have this, goal page, and it's for all of life. So I haven't, done it for career-wise for a while, but I check my progress at the start of every month. And so it feels really good. of, okay, what was good, what worked well, what do I need to stop doing, start doing, and continue doing. Also, can your mentorship triad, or like, do you have an accountability buddy that can hold you accountable, or someone that you can talk to about the potential barriers that you've identified? And then also just, next steps in accountability. What's the first step that you're going to take? If you've decided you're going to start a 12-week year, what's the first week going to look like? Can you share your goals with somebody? Because it's scientifically proven. Well, sometimes it's scientifically proven to hold you more accountable, but it's also supposed to give you the dopamine that other people are celebrating you, and therefore you don't need to achieve the goal. So find that balance, because I know there's new literature on that. Are you going to have some sort of tool to measure and celebrate your success? So hopefully this was helpful. I know it was pretty fast. That hour just flew by. But hopefully that kind of gets the ball rolling, gets those, goal setting juices going as well, so you can start to feel inspired. And I would say too, I'm not at where I want to be in my career. I've been applying to medical school for a while now. It's very competitive. And so I always have a bit of a plan A and plan B. And it kind of sucks to not be where you want, or have to try to think of, what's the other path. But I would say that's kind of one of the best times you can do goal setting is start to make a get to do list. What are the things that excite you? What can you do regardless? What's the impact that maybe you're not where you want to be right now, but maybe the journey will still take you there, and what's the impact you can have? So I would say, yeah, just keep following those passions. It's 100% okay to not be where you want to be. I think most people are, and we just don't talk about it enough. And yeah, I hope this was a very kind of handy session, and hopefully people will, I'd love if anyone wants to do a check-in, do the quarterly 12-week stints, share their goals or anything. But yeah, I will leave it at that. Let me figure out how to stop recording. There we go.